Welcome back, everyone. Our final segment here on WAJR's Ask the Experts, being presented by HealthWorks Rehab and Fitness. Tony Caridi along with Sara Stepp from HealthWorks and Dr. Ann Murray from WVU Medicine. Again, a reminder, they'll be hosting a free HealthWorks for You seminar coming up Thursday night, October 10 at 7 o'clock at HealthWorks Maple Drive location, and they will be able to address your specific questions and provide more information. Let's talk about the evolution of getting treatment. So how does the process begin if someone thinks that potentially they or someone they know has an issue? How does it begin, Sara?
So typically they can, if they, realize something's going on, they can either go to their primary care doctor and say, hey, I'm concerned about this is happening, and then hopefully get referred out to a neurologist, movement disorder neurologist like Dr. Murray, and then Dr. Murray would go through her whole evaluation, like she spoke earlier about, getting them on the, making that diagnosis, getting that diagnosis correct, and then getting them on the right medications. And then from there, she would write a script and then send them into me or any physical therapist, really just to get them moving.
Dr. Murray, how difficult is it to diagnose? We've been talking a lot of Parkinson's here, but there's a lot of other things. How difficult is that diagnosis? Is it a long-term call?
It's a great question. It's complicated, meaning any neurologic diagnosis is complicated. It really is probably in a lot of ways a lot to ask of the primary care doctor to really nail the diagnosis every time, and that's really not my expectation. And I think our primary care doctors are great, and oftentimes the ones that have seen Parkinson's a lot are as good as any neurologist. But it's more to say that the question to me is this idea of anybody, provider, patient, whoever it is, of if we're not getting answers, if things aren't making sense, if you're not your normal self, then we got to keep digging. And if we get that answer, great. But if we don't, we got to keep digging. And that's really where the neurologist can come in, where we really are experts. We're really specially trained in recognizing, diagnosing, and managing neurologic disease. And I think that that's a really big point. We're a team here. We're going to rely on the community. We're going to rely on friends and family. And I tell my family that, right? That it's our job as kind of community members to say, hey, if we feel like somebody's not their normal self, how can we help them? And that's true whether it's dementia or Parkinson's or stroke or neuropathy. The list goes on and on. It's really a team effort.
Staying on the topic of Parkinson's, you mentioned medication certainly helps, but is there one established thing that is the given that you have to do once you receive that diagnosis?
Yeah, I mean, the short answer is movement. Move. Really, when we look at research studies across the board, what has been the one thing that's impacted the disease? Hands down, it's exercise. It's being active. Now, we think that the way I look at it, or the way I often counsel patients, is that the medication, the treatments that we offer help enable them to move, but the treatment in isolation isn't going to be the fix. The treatment is a bridge to get to the fix, which is actually getting them exercising, getting them moving. And it doesn't matter in my mind. I often tell them it doesn't matter specifically what you're doing. It just matters that you're moving. But we do have lots of tried and true kind of research-driven exercises. Those are things like rock steady boxing, the program Sara was speaking of, specifically targeted exercises for Parkinson's patients or stroke patients. All of them have a specialized program, but the point is get moving.
Interesting. So here's another question you can't answer, but I'll ask it anyway. Why do you think the movement deals on that disease?
Yeah, well, specifically, it comes back to the physiology in Parkinson's, really the mechanism of what's going on in the brain. So the brain in Parkinson's doesn't make enough dopamine. To keep it simple, movement, physical exercise releases dopamine. This is one of the reasons why it feels good to exercise, right? Now, there's a big difference between it feels good to exercise. Then I often tell my patients, rarely are you going to wake up and say, oh my gosh, I'm so excited to exercise today. Very rarely does that happen to any of us, but it's really that choice, that decision to say, I know this is the right thing for me to do. I'm going to do it. And I can promise you, once you do it, you're going to feel better.
That's really interesting. So, yeah, so no one, it all makes sense, right? The dopamine is not going to say, hey, it's time to exercise. But once you start the push, then it goes, okay, here I come. I'm going to come out. And obviously, that's really good stuff. So there is, I guess, bottom line to all of this is that there is new opportunity and new hope that did not used to exist for people that have been diagnosed with neurological diseases. We've talked a lot of Parkinson's, but there's so many other things that can now be aided through medication and obviously through physical therapy, which is available throughout the area thanks to HealthWorks and now expanding into Waynesburg as well. So if you've heard something here today on the program that may help you individually or someone that you know, by all means, contact your doctor, contact the folks at HealthWorks, and begin the process. And if you want to learn more, these two folks, Sara Stepp and Dr. Ann Murray, will be hosting you for a free seminar, HealthWorks for You, coming up on Thursday night, October 10th, 7 o'clock at HealthWorks Maple Drive location, and they can get into more specifics. Dr. Murray, Sara, thanks so much for being with us.
Thanks so much for having us.
All
Thank
right.
you.
We invite you all to stay tuned. More coming up here on WAJR.